Okay, we're up to 71 now. So, and it's just gone after 2. So if we're all okay, I think we should start. Brilliant. Okay, so I'm Lindsay Dillab and I'm the head of UK Says No More and Domestic Abuse Prevention at Hestia. And we're really grateful for you to that you've joined us today. This is a big day for us. It's part of our No More Week, which we've joined in partnership with No More International. And we are part of their series of events where across the world we'll be talking about different experiences, all the way from Ecuador and Colombia on the 11th of March. Washington State's chapter of No More will do a presentation again on the 11th of March. And then on the 12th of March, we've got Forward, a UK-based charity who will be presenting on sexual harassment on campus. All of those webinars can be accessed via the No More site, and you can sign in and register in a similar way that you did to this one. But today, UK Says No More, which is our UK chapter of No More, which will be presenting on the community response to domestic abuse. We'll hear from our partners in the Safe Spaces Pharmacy Response, the General Pharmaceutical Council, Boots UK and Morrisons. And from the Home Office, we'll hear about their Ask for Any code word scheme. And finally, from Royal Mail, Charlie will talk to us about the development and the impact of online safe spaces. But I think it's really important to acknowledge that all of these projects have one very clear common goal, and that is to improve access to specialist domestic abuse services for those people who are enduring domestic abuse. We've looked and worked with the community as a whole, businesses, to find different ways and means that we can work together to provide these opportunities. I think just before we go into a bit of background about safe spaces, a little bit of housekeeping. So throughout today's presentations, please do pop any questions and answer questions in the Q&A box. And towards the end of it, we'll have a panel discussion and opportunity for the different speakers and presenters to answer those questions. The event is being recorded and will be available to share a couple of hours after the event. So please do leave your cameras off if you don't feel comfortable, or pop them on if you do. And then if you don't mind keeping yourself on mute throughout. But I think most importantly, what we'll chat about today could be triggering. We will be speaking about domestic abuse and the lived experiences of those that are enduring domestic abuse. And if you at any point feel like you need to talk to somebody or you would like to have a conversation, we'll pop in our details about our advice line in the chat function. You can call us or you can drop us an email. The advice line is womaned by a team of independent domestic abuse advocates who are all really available and ready to offer any support. So I think before I present and hand over to Sarah to introduce everybody, a little bit of background about safe spaces and perhaps a little bit of background about UK Says No More. So UK Says No More is a national campaign, as I mentioned, part of the international No More family, facilitated by Hestia, which is a London-based charity which provides different types of support, but in particular, support to women and children who've experienced domestic abuse through their refuge provision, to support to men and women through the independent domestic abuse support. But also it provides support around and for those people that have been victims of modern day slavery or experiencing long and enduring mental health support needs. So in many ways, Hestia as a charity both provides support, but also enables us to think about what we can do as an organization to offer a preventative measure around domestic abuse. How can we support those that are enduring domestic abuse reach those services that so desperately are available to offer that support? And I think one of the key things for the development of safe spaces is that it came from the lived experiences of the women who work within our services and who are supported by us. Early in 2016, 2017, we undertook a pilot development project of an app called Bright Sky, which many of you may know about. It's free to download. And in that, we asked some really crucial questions. And one of the ones that came back overwhelmingly was that many women said that before they had entered into our services, they hadn't known that these services existed. Or if they had known that these services existed, they didn't know how to access them because actually it was incredibly difficult. So Bright Sky as a tool enables people to locate their local domestic abuse service via GPS location. It provides advice and support if you're enduring domestic abuse or if you're concerned about a friend or a family member. So we knew that we had a tool that was available to us that we could use to provide an opportunity for people to access support. But back in 2018, we had a challenge, and a challenge that we sat with the TfL, Transport for London, looking at. And we thought to ourselves, how could we provide opportunities in the community, perhaps even on the tube, where there were safe spaces that somebody could access support, where they perhaps weren't being monitored, where their time wasn't being monitored, and there was a justifiable reason why they would be a little bit longer because perhaps the train was delayed. We explored this opportunity, and although the TfL were incredibly supportive, we had a number of challenges, and our key one was the fact of accessibility and ease of gaining access to this space. So following that, we worked with Islington Council at the end of 2019 to look at how we could work with businesses on the high street to provide community safe spaces. Overwhelmingly, we received a positive response, with many small and medium-sized businesses and community spaces coming forward, supported by training and ready to go in providing that opportunity to provide information about domestic abuse support services. But also, if somebody needed to access a safe space, they could have attended their business. Ready to be launched in early 2020, we, like the rest of the world, were overwhelmed with change when we experienced the first COVID lockdown. And what's quite interesting is that we'd started early conversations with Claire from the General Pharmaceutical Council, and just days before we went into lockdown, Sarah travelled up to meet with Mike and Lisa from Morrisons to talk about what we could do together around safe spaces. So what we knew at the end of March, when our Prime Minister stood at the dispatch box and told us that staying safe would mean stay home would mean stay safe, was that for most people who are experiencing domestic abuse, that wouldn't be the case. And that if you had been enduring domestic abuse prior to COVID's lockdown, that the incidences of violence would increase, the opportunities for the perpetrator to monitor and control would increase dramatically, and the opportunities for being able to access support and help would decrease overnight. We knew from the women and men that we've worked with how they used everyday opportunities to access support. On the way to school, just chatting at the gate, for example, that would be an opportunity to speak to a specialist support service. If they traveled to a community centre, a children's centre, or even if they were on their way to work, in the workplace had always previously been respite in a safe space that you could engage with specialist support services. So what we knew at this point was that we had incredible partners who were really keen to work with us, and that actually we had an opportunity to see where we could create safe spaces with them. We knew from what the government was saying to us with regards to lockdown that there would only be a few opportunities. One of them would be food shopping, so going to your supermarket, for example, and the other one would be visiting pharmacies. So quite quickly, we were able to work with pharmacies to think about how and what that would look like. And Mark from Boots UK will talk a little bit about the journey from their perspective. And obviously Lisa from Morrisons will talk about theirs. But I think the key thing that we found in these early stages is that not only were the pharmacists themselves overwhelmingly keen to think about a response, but they had already been providing a response to people who'd been during domestic abuse. And that consultancy rooms were an ideal opportunity. They were quiet, they were easy to access, they provided an opportunity for somebody to say, I'm nipping to the pharmacy, and they would then be able to contact their friends, their family members, or use the National Domestic Abuse helplines, or even contact their local specialist domestic abuse service. All of this provided an opportunity for people to access support. What we knew, and what we now know about the first lockdown, was that there was a 57% increase in downloads for Bright Sky. So we knew that people were out trying to seek support, trying to seek information. But we also know that those that choose to perpetrate abuse will not only use physical measures to control and coerce their victim, but they will also use technology. And so actually, the ability to use the internet, for example, or to use your phone to contact support becomes increasingly difficult if you don't have a safe space in which to do it. We knew from overwhelmingly that an increase to national domestic abuse helplines spiked. And on average, in the first lockdown, all the way through to just before Christmas, we saw an increase in referrals to our domestic abuse services, in particular refuges. This time last year, perhaps, for every vacancy that was advertised, 3 or 4 families would be asking to use that space. Since COVID, that's increased to now between 9 and 10 families requesting that space or that vacancy, which means that increasingly there are more families that are unfortunately unable to access a refuge space and in dire need of that support. Just this past lockdown, we've seen an increase of over 30% in requests for support across our domestic abuse services. So I think what I'm saying before I present and pass over to Sarah is that we know that there is an increased need for specialist support services. We know that those that are experiencing domestic abuse need every opportunity to be able to access those services safely, and that the journey and the pathway to those services often rely and start with the community, with that first disclosure to a friend, to a family member, or a colleague at work, and in this instance, the first opportunity to access support via a safe space. We're really chuffed to be able to say that just under 5,000 pharmacies across the UK are safe spaces, that we've worked with TSB to pilot a safe spaces opportunity within their branches. And Charlie will talk about the impact of safe spaces online and how many people have been able to engage with those particular services that way. And I think, we've had an incredible journey over the past 12 months. And we're really chuffed to have been able to work so closely with the Home Office to launch their Ask for Annie code word scheme and see how brilliantly both schemes work together. Safe Spaces providing that self-guided support opportunity, and Ask for Annie, as Jade will go and explain in a little bit more detail, talks about an immediate response, enabling the police to respond there and there to any request. So without further ado, I'm really happy to introduce Sarah, who is UK Says No More's Partnership Manager, and who has worked alongside all of these incredible partners over the past 12 months to deliver safe spaces. She'll be able to guide you through the introductions over the next hour, and I will see you again during the Q&A. Please, again, as a reminder, pop any questions as we go along, and we'll make sure that we will either answer them during the Q&A or answer them in the follow-up email where we send this out. Thank you. I'll pass over to Sarah.
Lovely. Thanks, Lindsay. It definitely has been an incredible journey. And as Partnerships Manager, I would say that it's been an absolute pleasure to work with all of the Safe Spaces partners, and we're going to hear from obviously some of them a little bit today. With these partners, I think I've been able to have right from the beginning quite open and honest conversations as to how we can create a model that not only meets the kind of needs of the victims and kind of honouring that victim's journey, but to accessing that kind of support, but also to meet the needs of the pharmacy too and their members of staff. And we were able to achieve that right from the beginning by having those kind of open and honest conversations. I think one of the key things to remember, with the kind of Safe Spaces scheme is that it just wouldn't have been possible. We would not have been able to have reached as many victims if we had, if it wasn't for these partnerships and just their sheer willingness. I think that's the word to describe it. It's just their willingness. So yeah, just a massive thank you to each and every one of you and all the partners that have been involved within Safe Spaces. And of course, a massive thank you to the staff as well, like each victim who has walked into, let's say, a pharmacy and had to kind of like encourage, and they've had the courage to kind of walk up to that healthcare counter and ask to use that safe space. And that member of staff has kind of responded to them. They've shown them where that safe space is. And I know many of those members of staff have actually gone kind of like above and beyond. They've offered them like a tissue, they've offered them some water, they've offered them some food, alongside that safe space. And for me, I think that there's been a lot of talk over the last year as to kind of like who are our community kind of like COVID heroes, who are our unsung heroes. And I think for me, and obviously everyone at Hestia, we think without a doubt that those kind of like heroes naturally are the pharmacists who are at the heart of this scheme of safe spaces. So yeah, just a massive thank you as well, not only to our partners, but of course the staff who are on the front line providing those safe spaces and facilitating them in their consultation rooms within their pharmacies. So to get started, I'm going to hand over to Jade Willisey, who's from the Home Office. She's going to be our first speaker. Hoping that we've resolved the tech issues that we had a little bit earlier for Jade. And Jade's going to be telling us a little bit about Annie and the code word scheme. So I'm going to hand over to Jade now.
Hi, thank you, Sarah. Can I just confirm that you can hear me?
Yeah, we can hear you.
Perfect. And are you okay to share the presentation? Just because I am I'm on my phone doing it, because it appears that unfortunately Home Office IT is so advanced that you can't use Zoom.
That's fine. I think Lily will be able to, Lily's got it, so Lily will share it now for you.
Lovely, lovely. Thank you so much. Yeah, so thank you very much for the warm welcome. So I'm Jade Willisey from the Home Office Domestic Abuse and Strategy team. And just first and foremost, just wanted to say thank you for giving us the opportunity to present. As Lindsay said, I'm here to tell you more about Ask for Annie, why and how it was developed, and how it's going so far. And then just a bit of an apology. We've got a really busy week this week with the domestic abuse bill being at report stage, so I won't be able to stay for the whole conference and the questions at the end. But I've agreed with Sarah that we will take away any questions that are for the Home Office and come back to you via email. So the next slide, please. So why develop a code word? So the Ask for Annie code word was developed to provide a way for domestic abuse victims to signal that they needed immediate help because they're at risk of domestic abuse. The scheme, the development of the scheme began following the national lockdown in March 2020, and of course was in response to the COVID-19 pandemic. Similar schemes have been implemented in both France and the Canary Islands in response to COVID-19 restrictions, and obviously have seen and still see victims spending more time at home with their abusers, and of course this makes it harder to access support. So the code word scheme Ask for Annie is being supported by the Victims Commissioner and the Domestic Abuse Commissioner. And from the outset, the scheme has been designed to work alongside Hestia UK Saves No More Safe Spaces scheme. And I just want to say a massive thank you to all those involved. So throughout the process of developing the scheme, we've been really grateful to the sector for providing help, support and challenge, and really to make sure the process is safe and straightforward to follow. It was very clear that for individuals that this could be the only opportunity to seek help, and that just by asking for help, the victim could be putting themselves at risk. So as Lindsay said, the pharmacy environment lends itself really well for the scheme because of the private space available through consultation rooms, and because pharmacy staff are trusted professionals and they have that safeguarding training. And I should say that the scheme hasn't been designed to create an extra layer of support for victims, but really to facilitate and assist someone to access existing support and help through the police or national or local helplines. And the scheme is intended to provide a route for the most isolated of victims who don't have other ways to reach out and access services. So for that reason, we also did expect low volumes using the Ask for Annie scheme. The scheme is not mandatory, and we wanted pharmacies to be able to decide themselves if they can run the scheme safely. And of course, if you are a pharmacy and are interested in finding out more, then please do get in touch. And again, that will be via Sarah. So what happens when someone uses the code words? So the next slide, please. So we've worked with pharmacy organisations such as the National Pharmacy Association and an advisory group, which includes sector groups, academics and the police, to create an 8-step process, which you can see set out on the slide. And the idea really is when someone sees the symbol or uses the code word, the staff member acknowledges, responds and reacts. The first step is for the staff member to stop and hear the request. So staff will be trained to receive the request for help in different ways, including if it's written down or if someone says something like, I don't feel safe to go home. And the staff member should confirm that they've heard the word and offer to accompany the survivor to a consultation room by saying, so you'd like to speak to Annie, okay, come with me. After explaining that the process is confidential and what assistance is on offer, they should explain to the individual that they could get help from the police or from a national or local helpline. The staff member should ask the survivor if they would like to make the call themselves or they would like the staff member to do that. And if the individual prefers, they can be alone or they can be supported throughout the process. If the police are called, the survivor is then offered somewhere suitable to wait, away from the shop floor. And a couple of things in the development of the scheme. So as we've engaged with the scheme, engaged with the sector and the police, both have raised the fact that the scheme, for example, may be less well utilised or slower in the countryside, so a slower police response where forces have larger coverage, rural areas, and police have further to travel to get to pharmacies. And also where communities are closer knit, staff in pharmacies are more likely to know the victim and therefore the individual may be less likely or less keen to use the code word. What I'll say in response is we've covered confidentiality in the guidance and have full confidence that obviously police call handlers will utilise their expert knowledge to dispatch help in the most effective way. But these two things are definitely some of the things that we'll be looking at in the evaluation of the scheme, and I'll come on to more about that later. So on to the next slide on guidance. So it's really important for any pharmacy to understand what their role is and how they are making a difference. It is therefore a required feature of this scheme that the pharmacy agrees to complete training before they sign up to Annie. And guidance for the scheme has been developed with Safe Lives, and we're extremely grateful to the role that they have played. We've also been really grateful to UK Says No More for their help in developing the guidance for pharmacies and who are already running safe spaces. I think I saw a question in the sidebar, but we've also been really grateful to the Scottish officials and those from Northern Ireland and Wales for helping us to make this, to include information in respect of all the nations. And this has made it possible for us to work with those pharmacies whose business model means they have stores across the UK. On training, within the slides, and we can share this round, I've just attached the training video. So if anyone wants to have a look at their leisure, then please feel free to do so. So that is the next couple of slides. So onto the launch slide, please. So since September 2020, we've been working with pharmacies to encourage sign up to the scheme. Boots signed up to the scheme in autumn last year. This was facilitated by Hestia and provided a geographical spread of 2,300 participating stores. And in addition to that, we have a further 1,900 additional pharmacies, and that includes chains and independents as well. So we are so grateful for the sort of overwhelming response and participation that we've had so far. In planning for the launch, we're really conscious not to overexpose the code word, as obviously this is a discrete scheme, but we also needed the message to get out there. So it was a balancing act. But again, grateful to Boots, the MPA and local forces who helped to share and amplify the messages on the launch of Ask for Annie. In mid-February, also Safe Lives also gained some really positive media attention for Annie with a supportive interview with the Duchess of Cornwall. So how is the scheme being used so far? So as of the 8th of March this year, we've had 45 uses of the code word scheme in just under 2 months, and that's it's higher than what we envisaged. We purposely avoided trying to, you know, give predictions on uses, etc. But it is really positive that we've been able, that the scheme has been able to help these 45 individuals. And just to break that down a little bit, in 22 of those cases, they've used the code word Annie, and in a further 10 of those cases, they've asked for a safe space. And 8 of the calls have been made to police forces, with the majority of people wanting to access national or local helplines. So on to the evaluation and where we're going next. So just the next slide, please. So there's a wide range of work being done on the community response to domestic abuse, and of course Ask for Annie is just one of these options, but it is really important for us to know how things are going, and as such we're working with Ipsos Maori to evaluate the scheme, and we'll review the findings with pharmacy partners and the advisory group as well. The evaluation itself will involve speaking to those involved in the scheme, collecting data on use and response times, and try to understand what's working and how we can continue to improve the scheme. The evaluation will launch on Monday, so that's Monday the 15th, with surveys going out to participating pharmacies, police and call handlers, and we are expecting early findings around the end of June, July. That is everything from me. Just wanted to say, you know, thank you very much for taking the time to listen and hear a bit more about Ask for Annie. And if there are any questions, then please feed them through to Sarah. Thank you.
Lovely, thank you, Jade. If you have joined us today and you're a pharmacy and you are keen to adopt Annie in safe spaces, then please do get in touch. I know that we have popped all the contact information in the chat bar, so you've got it all there to reach out and contact us. Our next speaker is Claire Bryce-Smith, the Director of Insight, Intelligence and Inspection. I tried doing that without looking down my notes, at General Pharmaceutical Council. Right at the beginning of the implementation phase of kind of safe spaces, Claire played quite an instrumental role, encouraging pharmacies to open up their consultation room and to facilitate a safe space for victims of domestic abuse. So Claire is going to talk to us today a little bit about why pharmacies hold that unique position within the community to facilitate those safe spaces. Over to you, Claire.
Thank you very much, Sarah. Can everybody see my screen?
Yep.
Yeah, perfect. Okay, thank you. We'll just do that. Oh, it's not coming up as a full one. I'll just carry on doing it. Oh, can everybody see? Can everybody see the presentation? Sorry. Hi, can you actually see my presentation? I can't see anything other than the presentation.
You can see it, yeah.
Okay, thank you very much. Sorry. Okay, everybody.
It's just on the PowerPoint page, so I don't know if you want to go to start PowerPoint so that it's the whole screen, but like this is fine as well.
Okay, let me just, sorry, can you see that now? Apologies, everybody. Okay, I'm going to cover today who we actually are, the organisation that I represent, so that you know that, why and how we actually got involved, because we're, strangely enough, as a regulator, we're not a direct service provider, but we did have a part to play. And for anybody maybe listening in who maybe plays a slightly different role, yeah, you may be interested to hear what we did. And then I am going to highlight, as Sarah said, a little bit about the unique position of pharmacies within communities from our perspective, and then a very short reflection from me on the partnership itself. So who actually are we? We are the regulator of pharmacy across Great Britain. So that means we cover England, Scotland and Wales. Just to give you an idea of that, there's just over 81,000 pharmacists and pharmacy technicians who are the professionals we regulate, and just under 14,000 pharmacy premises as well. Our core purpose is actually patient safety and upholding trust and confidence in pharmacy. But really important, we don't just do that for no reason at all. It is actually to protect the public. So we have a public locus there. And there are many ways that we do that, but the most relevant for today is that actually we set standards for pharmacy professionals and for pharmacies, and that's for safe and effective pharmacy care to the public and patients. And what we do is we make sure and we seek assurance that they actually meet those standards. One of the reasons for raising that is because it sort of provides the context as to why we got involved, because standard 1.8 of our standards is actually about children and vulnerable adults are kept safeguarded. So that's one of the reasons that we actually got involved. So for us, just to unpack this a little bit more, why we really got involved, some of it has already been mentioned by others, but the context of the pandemic was amazingly almost a year ago. And as you can see on the right hand side, it was actually the 16th of March that the Prime Minister actually said now's the time for everybody to stay at home. And on the 23rd of March was actually the official order to ask people to stay at home. And as already been said, I think by Lindsay, we realised that we were aware of the additional risks that this placed on people who were either already experiencing domestic abuse or who were at risk of domestic abuse. And we knew that as an employer, but also as our role as the pharmacy regulator. So we set up, as part of that pandemic, very early on, what we called a rapid response team. So we were trying to make sure that we could see what was going on the ground. So we actually corporately gathered together everything that we were picking up. And very, very early on, we were getting concerns raised with us from local authority domestic abuse teams, saying about local initiatives and how we might be able to help. But we felt with that national view, we knew that actually it was something that wasn't just for particular postcodes, it was actually everywhere. And there was a need to actually look, a very real need, and was growing very quickly. And it was something that really couldn't wait. So we were in a position, because it was a safeguarding issue, we were in a position to actually influence on a national scale, being a national regulator. And that was across England, Scotland and Wales. And we also knew that pharmacies at that time were incredibly busy and working flat out, as were other health professionals across health and social care. So we did use our position and our networks to make those connections on the ground and play the part that we could as a non-service provider directly to the public. So we did talk to pharmacy stakeholders, some of which are on the call now. So a whole range of representative bodies, but also the professional leaders of those pharmacies. And again, a couple of those are talking to you today. But we also did it through our communications, which I'll just highlight it later on. But also we're able to utilise our inspectorate as well. And I'm going to say a little bit more about that in a minute. So how did we actually get involved? We already knew of Hestia actually, and through the Employers Initiative on Domestic Abuse, which is actually a network of employees that come together to share good practice on domestic abuse. So we already had made that connection. We were aware of Bright Sky and the Safe Spaces initiative. And as Lindsay said right at the start, Sarah, I think, and Lindsay, we were due to meet just before the pandemic started. And that meeting didn't go ahead. So we did reconnect very early April. And what we did know with that very real and growing need, that the scheme was already ready to go, and it was able to help vulnerable people very quickly. And as I said before, perhaps the most powerful thing for us was that we knew the potential for this scheme to provide a consistent approach for people wherever they lived. And what we were keen to ensure was that there wasn't a postcode lottery, because it wasn't specific to certain locations at all. So in terms of the unique position of pharmacies, they were so important because of the scale and coverage. It's a very powerful network of places that people can access. As I said, it's just under 14,000 pharmacies across England, Scotland and Wales. And they are actually at the heart of many local communities. And therefore they are actually accessible to the public, as others have said. Interestingly, they were the only healthcare provider, and still are the only healthcare provider, that has actually been open to the public throughout the pandemic without an appointment. So the most important thing is people can just walk off the street into a pharmacy and they don't need an appointment for it. And in this context, that was absolutely key. And as somebody else has mentioned, all the services within a pharmacy are delivered by healthcare professionals. So they're highly capable and trained and competent pharmacy teams who are actually delivering those services. And they do have safeguarding responsibilities, and they've also received training around that. So not only the places are accessible, but actually those services are provided by healthcare professionals as well. So what did we actually do then as a regulator? You'll see on the right hand side a number of communications, but what we really did was we actually saw the context, the need, if you like, the opportunity that was actually out there to do something and make those connections. So we did raise awareness of that issue, of domestic abuse that was rising, the concerns particularly with lockdown amongst our pharmacy stakeholders. We actually made some of those introductions for Hestia first, so they could go and speak to those throughout our network. And we ourselves then promoted how safe spaces could actually help vulnerable people. You'll see those on the right hand side. We encouraged pharmacies to actually take up the scheme. We can't make them do it, but we encourage them to do it. And we also showed how this was a way of demonstrating how they met that standard that I mentioned at the beginning, ensuring that vulnerable children and adults were protected and safeguarded. You'll also see there that we have also done that for Ask for Annie as well, so that actually pharmacies can choose whichever scheme or both of them to actually help the public. And importantly for us as well, it wasn't just pharmacies. We tried to raise through social media, through our website, through webinars to the public as well. And then for us, the main thing that we could do that others couldn't was that we have our own field force of inspectors throughout England, Scotland and Wales, and we were very much in supportive role. So we used our inspectors to promote the scheme on their calls, with just over 4,000 calls made to pharmacies during the pandemic, encouraging them to become safer spaces. So last slide from me, because actually the real people that have done the work are the ones that are coming, and those are the pharmacy teams and the pharmacy leaders. So this is just a very small reflection from myself about the partnership. And for me, the pieces of the jigsaw really symbolise what's happened here, I think, and the power of collaborative working. It's really when leaders from a number of organisations from all sectors come along. So Hestia from the charity sector, ourselves as a regulator, a number of stakeholders and leaders of pharmacies, both large and small, coming together for a common purpose. To make something happen really quickly during what was, quite frankly, the most extraordinary times we all found ourselves in and are still in. But the important thing, it was actually to help individual people suffering from domestic abuse in need of a lifeline, and that safe space within a community pharmacy actually ensured that they could get that support they needed. And in the end, of course, it was all made possible by really the dedicated and courageous pharmacy teams who are already under considerable pressure, but recognised the need and made that happen. And as has been said before, now in your thousands. So, but I think finally, the last word has to go really to the lady that left this note in a consultation room, a safe space in Leven Pharmacy. On the last occasion that she actually used it, which for me just about sums up why we're all here and the impact of safe spaces and code word Annie schemes. And that is, thank you, your safe space has without exaggeration saved my life. Thank you. Over to you, Sarah.
Thanks, Claire. That's just really powerful to hear. I'm going to hand you over now to our next speaker, who is Mark Donovan. He is the chief, he's the chief pharmacist at Boots UK. I talked earlier a little bit about those kind of open and honest conversations we had with our partners right at the beginning, and I certainly had a few of those with Mark right at the beginning, where we were trying to mobilise a 4-nation rollout of safe spaces, and it was Mark's sector insight that was really invaluable for us to get safe spaces over the line. He's been a complete advocate, and his continuous support has really encouraged other pharmacies to get in touch with us and to open up their consultation rooms to facilitate safe spaces. So I'm going to hand you over to Mark to talk to us about Boots' experience of safe spaces and some of their learnings.
Thanks very much, Sarah, and thank you for inviting me to talk. I haven't got slides, so I'm just going to talk at you, if that's okay, for 5 to 10 minutes or so. I'll just give you some reflections of Boots on the delivery of the Safe Spaces scheme across the UK, and also the implementation of the Ask for Annie scheme as well. So I'll give you a little bit of background to our organisation and some learnings, and share some of those stories that Claire began to share then, that we've learned from and understood from those people who are experiencing domestic abuse through the implementation. So Boots has around 2,500 pharmacies across the UK. We employ around 60,000 people, which will be relevant when I get to the end, and dispense around about 200 million prescriptions a year. So we know that many people will come into our pharmacies across the UK and use our pharmacies on a day-to-day basis. And we know, as you've heard, that access to healthcare has been restricted during lockdown, but as Claire said, pharmacies have continued to stay open and provide that service to people across the UK. This, as you know, is not a Boots initiative, and it's really important to remember that there are 14,000 pharmacies in the UK, all of which can play a part in supporting those who are experiencing domestic violence and domestic abuse. And we believe that pharmacy is a key and accessible element of primary healthcare. And through the lockdown, we have attempted to provide that accessibility to patients, to customers, and those who need to access healthcare, as well as support like we're talking about today. So we recognise that victims of domestic abuse had their access points limited during lockdown, and so of course we thought we could help out, and working with solutions with the GPHC as well as Hestia and the Say No More campaign to introduce safe spaces in our consultation rooms. Right at the beginning, we developed that plan really quickly. Communications were sent out to our pharmacy teams, but really importantly, at a time of overwhelmingly high workload for all primary frontline healthcare workers, we thought it was important to ask our pharmacists direct if they think that we should do this. And I remember having them on a call and putting it to a sort of a poll, and overwhelmingly they said, yes, we are seeing it. As Claire said, early on in the lockdown, we know that there is an opportunity for community pharmacy to make an impact here, and we would want to get involved. So off we went very quickly to send posters, to training toolkits, access to the Bright Sky digital app via the iPads that we would have and use operationally in all of our pharmacies, and introduce safe spaces in our pharmacies across the UK. Every year we undertake a CSR survey on a number of different things across the company. That happens in August, and one question last August that we asked was around safe spaces, and in total, 340 stores were selected to report on the CSR survey, and out of those 340 pharmacies, 600 uses of our consultation rooms were reported in the period up to the end of August last year. And it's really important to, and we need to be really careful with extrapolations, of course, but because some stores reported up to 20 occasions when a safe space was requested alone. But on average, each store and each pharmacy was asked for a safe space just under twice in the first 4 months of introducing the safe spaces. But the power, and I'll share some of the stories really. The power really is in the stories, and of which we've had many, very simple and straightforward interventions that our pharmacy teams have had, where helping people who are affected by domestic abuse, giving information, referring to helplines or social services for support, and then stories around people who perhaps, the story I'm referring to in Scotland, where one of our substance misuse clients came in. She was very upset. The store manager took her to the consultation room for a conversation. She found out she's been assaulted by a partner, and gave the contact number, some food, as Lindsay and Sarah talked about earlier on, and helped her manage that particular time. There was another store, and this is an interesting element of our initiative and partnership working with Hestia. Is one of our regular patients who often visited the store with a partner. One of the times they visited, they were having an argument in the pharmacy, and the team noticed a gradual change in the behaviour and comments from the male partner that were controlling, which the pharmacist felt was abusive and a cause for concern. And the pharmacist carefully raised to concerns with the relevant people involved with the care. And the next time they visited the pharmacy, the pharmacist made and created an opportunity to speak to the female on her own in the consultation room. She asked if everything was okay at home and if there was anything that they needed, as the team had noticed a change of behaviour. And the female then explained things had been difficult at home. She was trying to move away from her partner, but was unsure, frightened to do so. And the pharmacist was able to give her information on resources that she could access. And if she needed somewhere safe to use, you could use our consultation room. And we learned that since that interaction, she's used the consultation rooms a number of times to make calls and get advice and talk with the team. And it's given her confidence that she does have somewhere to go, a team of people that are supporting whatever decisions that she makes going forward. And I think, especially in light of the pandemic, it's important that people who are experiencing abuse and domestic violence know that they have somewhere to go. As Boots, we initially only committed as part of this for a short period of time during lockdown. Actually, I remember the conversation I had with Lindsay and Sarah, but clearly the impact is extremely high. It's very well received by both our colleagues and those people using the service. It's not too onerous, and like I said, the pharmacy teams understand the impact that they were having. So we've agreed to make it a more permanent element of what we do in our organisation, and it's been welcomed by many across our organisation too. But as the initiative has moved on, we've had lots of lessons to learn, actually. As Claire said, pharmacy teams are very well trained in safeguarding. We have interventions needing safeguarding support all the time, and our teams know how to deal with those interventions. Adherence to safeguarding guidance, and also signposting to others when we uncover and have interventions which we feel that people are at risk. So it's a simple extension into helping those survivors of domestic abuse. And this initiative is very simple. It's not trying to fix every issue. It's a service to those in need and making other services more accessible. And consultation rooms that are in pharmacies have helped to provide that confidential space for having that conversation. We did have an issue with consistency, though. We wanted to rush it out, and something that we needed to work on, especially when we started to introduce Ask Annie, and also governance around the service, and understand how many people who have accessed safe spaces, where they go next in the system. And like I said, so there's lots to learn, but we were determined to learn from that experience as we worked with Hestia and the Home Office with the launch of and the introduction of Ask for Annie. So the improvement on training and consistency, especially when it's an initiative designed to be used in emergencies. We can't have a person wanting immediate support to be met with somebody in a pharmacy that doesn't know anything about it. So we embarked on training all of our pharmacists and all of our pharmacy technicians, both in the process of what to do on that request, and also the background capability on what domestic violence is and what to look out for. We sought confirmation that the training has been done and paid for that training too, and asked for confirmation that the pharmacies were ready to launch. One thing that was explained from the Home Office about how do we get that feedback, and we do two routes actually. We gather the evidence through our internal help desk, which has helped us understand what support is being given, but also importantly help us to know where to support those people who are having the conversations. So the colleagues in the pharmacy to have the conversations and support them in whatever they need. And that's very important to us as we started the Ask for Annie initiative, as well as safe spaces. Of course, we're across all geographies in the UK, and we needed to be cognizant of the devolved nations. I know someone had asked a question in the chat earlier on about that. We're working with Scotland and their Equally Safe policy, and with Wales with their Live Fear Free campaign as well, introducing devolved flavoured information in our consultation rooms alongside the Safe Spaces initiative as well. And we found that local police forces have had additional requests, which we've tried to accommodate as best we can as they get involved and help us and support us as well. Our experience of Ask for Annie is it's an extension to Safe Spaces. They work extremely well together. We've had roughly one Ask for Annie request each weekday across our pharmacies, and the stories are extremely powerful. For example, in the southeast, one of our pharmacies, a regular customer came in with a black eye. This is within the last few weeks, and told the pharmacist that she had had enough and wanted some help. The pharmacist escorted the customer into the consultation room and asked if she wanted to call the police. The customer called the police, and the police came and took a report from the customer, supported her in getting a bag collected from a home and dropped off the keys and took her to a safe place. And the partner and mother-in-law actually came into the store while the police were there, but the pharmacist and the team then managed that interaction and got them to leave while the police were supporting this particular customer. But there can be very simple interventions too. In one of our stores around Norwich, a lady came in with a child asking for use of a safe space and was taken into a consultation room. The pharmacist helped her to call the National Domestic Abuse Helpline. They received a call back while they were still in the store, and the lady and child are currently waiting for follow-up from that signposting from the housing and accommodation team. And what we're finding is, as a number of people have highlighted, the colleagues that we have in our pharmacies are going above and beyond here. In a store 2 weeks ago in the Leeds area, a customer believed that they were going to be killed by their mother, actually. They needed time to ring the stepfather, but needed to be away from the house until the mother went to work late at night. and the store was closing. So our colleagues escorted them down to the late opening pharmacy in the town, where they waited in that safe space for support to arrive. And they commented on how well the training that was provided to them supported in what to say to this customer, how to phrase it, how to support them while support was requested. And of course, like I said right at the beginning, we have 60,000 employees within Boots. And what we found and experienced is some of them are experiencing domestic abuse themselves. And we've had a number of people through working with Hestia and this scheme feeling able to disclose that and seek support to us as an employer too, since we've been involved in this initiative, which was insightful for me, insightful for our policy team internally, and has changed our approach to our individual colleagues as well. So I guess in summary, we think this is really important. It's supported by our colleagues in our pharmacies. We see our role not only to help those in need long-term through our pharmacies, but also to push this agenda across community pharmacy as a whole, because we know of the impact that is these initiatives are having in our communities up and down the UK. Thanks, Sarah.
Lovely, thank you so much, Mark. It's just so incredibly powerful to hear everything you've just discussed there. Thank you. Our next speaker is Lisa Layton. Lisa is the head of people in employee relations at Morrisons. Morrisons not only have adopted safe spaces in their pharmacies, but they've also explored all of the resources which they've had available that could act as kind of like further opportunities to reach victims. And they've actually displayed specialist support information on their till receipts, in toilets, and also in their petrol pumps as well. And Lisa's going to talk to us a little bit today about Morrisons' community response to domestic abuse.
Thanks, Sarah. All right, bear with me while I try and share my screen. It's always the good technical bits, isn't it? Okay, can you guys see that? Is that all good? I will make a start. So thanks for having me this afternoon. It's a real pleasure to be able to get involved in this, and this is something that Morrisons has been working on for quite some time now, and we first started to connect with Sarah and Lindsay probably about 18 months or so ago. So I will quickly go through what I'm going to cover today. There's a little bit of the why, and the why is really important to us. If we're going to invest energy and effort in anything, we always need to be really clear about our purpose and why we wanted to get involved. I'll share some thoughts around what we actually did throughout the period and ongoing, the impact that we've had, and also next steps as well. So why we got involved, I think there's a very, very obvious reason to begin with. You know, we need to be a responsible employer. We are a responsible employer. And our journey really started back in May 2019, actually. We started our research into domestic abuse and what our role as a responsible employer could be. The statistics at that point in time were a business case in themselves, never mind what we actually saw during the throes of the pandemic, and that we continue to see as well. At that point in time, we were really surprised to learn the extent of domestic abuse in the UK, and how 1 in 4 women and 1 in 6 men in the UK were impacted by it, and how victims were often targeted at work as well. And when we reflected on that internally around what this could mean to us as an employer, ultimately we kind of said to ourselves there could be, you know, upwards of 2,000 of our own female colleagues who are either survivors or current victims of domestic abuse, and around, you know, up to 900 could be male victims as well. So we had to do something as a responsible employer to support our colleagues when they really needed it. That was one of the primary drivers. Following on from that, this actually happened before I joined Morrisons. I've been here 4.5 years now, but prior to me joining, And subsequently I became aware of a story, the tragic story of Claire and Charlotte Hart. So Claire Hart was tragically murdered alongside her daughter Charlotte by her husband in 2016. And at the time of her death, Claire was a Morrisons colleague in one of our meat and fish counters down in our Spalding store. Following their death, an investigation into their lives found that they'd actually been victims of domestic abuse for years. The tragic events happened 3 days after her sons managed to help her flee the family home and move both Claire and Charlotte into rented accommodation. Her sons, who some of you may have heard of, Luke and Ryan Hart, survived because they were working abroad. And they've been working tirelessly since then to raise awareness of coercive control. So early in our journey, when we were investigating how do we approach raising awareness around domestic abuse within our business, we actually made contact with Luke and Ryan. One of my team met with them a few times to really get their advice, and they agreed to help shape our plans to support our colleagues. So they highlighted 3 priority areas for us as an employer: how we can raise awareness of coercive control and the impact that it can have, how to create an environment where employees experiencing domestic abuse really feel able to come forwards and disclose in a safe environment, and how to help managers spot the signs and give them the training to support employees. From there, we also connected with Sarah and Lindsay at UK Says No More, and they were really instrumental in challenging our thinking and help us move things on even further. And this really took us forward to getting into quite a strong position, whereby by the end of 2019, we were starting to feel quite confident about launching an internal campaign. But then COVID happened in early 2020, and Lindsay shared some statistics right at the start of this session as well. As things started to really accelerate with COVID, within the head office environment, we deployed a lot of our colleagues out into stores to really focus on feeding the nation and making sure that we kept the business running at the front end. Quite quickly though, through some of the business continuity calls that I was involved in during the pandemic, through the media, through our own internal conversations, it became evident that there was a real need to bring out all the work that we'd got ready around domestic abuse and start to accelerate the launch of that campaign. Through ongoing conversations with Sarah and Lindsay, we started to explore how can we go beyond internal, because initially our campaign had been very much focused around our colleagues before further down the line. And when we were saying further down the line, we were thinking probably about 18 months, 2 years down the line. But again, COVID really accelerated the opportunity there for us to do something to support our customers as well as our colleagues. So what did we do? We did a lot in quite a short space of time. We're an organisation that really wants to do the right thing, and for me it's a joy because I'm often pushing at an open door to be able to do some of the things that my team do to really make a difference to our colleagues and customers. So we created new colleague and manager guidance. Much of this was around setting new policy direction. How can we support our colleagues who may be victims of domestic abuse? We looked at financial aspects, we looked at time off to be able to sort affairs out, and we also committed within our policy to be able to support colleagues to relocate to other stores or sites if they needed to move away from their perpetrator. From a manager perspective, it was really, really important that our managers felt really equipped to be able to support any colleagues and handle any disclosures. So again, the guidance included lots of information, lots of tools and resources. We supported that by developing an intranet site. This was available for both colleagues and line managers, dedicated to domestic abuse with lots of information to raise awareness, and most importantly to signpost to support organisations. Underpinning the campaign were colleague stories, and like Mark has shared, stories always creates more engagement, and we were very lucky in one sense that one of our colleagues heard that we were investigating doing a campaign around domestic abuse, And she stepped forward. She said, I'm a survivor. I really want to get involved in this. If I can help make a difference to at least one colleague, then I can feel great about that. And that colleague has been instrumental again in reviewing our content internally, looking at it from a different perspective and advising us from her perspective as a survivor as well. We created lots of posters for toilets. So again, very basic stuff. But the key thing here was to just continue to raise awareness so that if anybody did need the information, they knew where to go. As always, similar stories to yourself, Mark. Our colleagues go above and beyond, and we've heard numerous stories where line managers have, again, found the guidance really, really helpful in helping them understand how they can sensitively approach the subject and how they can help and signpost colleagues. And we've equally had stories of some of our teams out in stores having to get more involved than they probably should, to be fair. But again, it's going above and beyond their day job because they really want to help that person who's in trouble in that moment in time. The work that we did with Sarah and Lindsay helped us step it on from a colleague campaign into a customer campaign as well. We used the opportunity, so we have 117 pharmacies within our stores. We've got about 500 stores at the moment, so just over a fifth of our stores, we were able to set those pharmacies up as safe space as well. Again, all of those pharmacies have got the relevant safeguarding training and experience, so they were ready to go and really, really keen to get involved with the campaign. We put more posters up in customer toilets. We used some of the contents, again, co-created with UK Says No More, advertising the Bright Sky app, so that, again, we could just raise awareness for those who were in need of it at that moment in time. And again, the joy of being a supermarket, I was thinking, how do we reach more people? How do we create more opportunity? Well, everyone takes a till receipt home with them when they're shopping. And again, just subtle messaging on the till receipts that we were able to change, as well as when you're at the petrol pump and you're filling up your car, subtle messages around the help that is available if anyone needs it. And my team, the employee relations team, received some specialist training from UK Says No More so that we could be an escalation internally for any of our line managers that were needing additional help and advice in supporting their own colleagues. So lots of information. Ultimately, our objectives of the campaign were to become committed to providing support to our colleagues who are experiencing domestic abuse, raising awareness around the types and the impact of domestic abuse, create an environment, most importantly, where colleagues feel encouraged and are able to seek support through Morrisons, and to create an environment where line managers are really able to spot the warning signs, notice the absence of normal, and follow the steps to make sure that our colleagues are taken to safety and customers are taken to safety in the pharmacies as well. So I'll just quickly share a couple of slides around the impact. Whenever we do some internal campaigns, it's amazing to see how our colleagues support this. And this was one initiative that generated so much passion and interest and engagement from our colleagues, and particularly out in the community with our customers. So we have a community champion within each of our stores, and lots of them already personally make a difference to some of their communities, whether it be women's refuges or other support organisations, and it's within our gift to continue to do that. But these are some internal messages. So we have an internal Facebook group. We've got about 25,000 colleagues that are on that group, and these are some of the comments that those colleagues have shared. So again, you can see here the initial launch and colleagues asking for help and support. What would be the procedure to help a friend who's experiencing verbal abuse? So again, we can take it beyond our colleague base so that they can help their friends and family members as well. Different stores sharing their own stories around how they did donations to domestic violence safe houses, again, taking toiletries or food. On the right hand side, again, we can see other donations, particularly where women may have their children with them as well. So supplying books, magazines, colouring puzzles, and so on and so forth. And we're also looking in the future, how do we set up potential new starter packs to be able to support women's refuges more proactively as well. And there we can see one of our community champions handing over a cheque of nearly £5,000 to a local domestic abuse service. So we're lucky that we've got the Morrisons Foundation. So again, we can make applications to that charity, and the stores often raise money themselves, which is then doubled by the foundation. So we're able to boost the contribution that we can make to such good causes. And then the really important one I mentioned earlier is colleague stories. So one of our colleagues agreed to go on film, share her story. It was quite raw, it was quite emotional, but that was something that just connected with so many of our colleagues. And some of the, I guess, celebration in a weird way that she received through our colleague Facebook pages around her bravery, around being inspirational. And she's really pleased that she was able to contribute, more so that she can again make a difference and help any of the colleagues who may have been in a similar situation to her when she first experienced abuse from her partner. And what this tends to do whenever we do share colleague stories, it encourages a real community feel. When we talk about things, colleagues see each other sharing stories so that they feel confident in that safe environment, in that safe space to be able to share their story as well. So you really generate, I guess, a sense of camaraderie amongst each other, knowing that there's a bunch of people who they may never even meet, but there's a bunch of people who's really got their backs, and they've got the support of their colleagues and the support of the organisation too. So what's next for us? This is something that we continue to feel passionate about. It's something that we can do so much more on. We are investigating the launch of online safe spaces, which I think we'll hear about more shortly. We're just looking at the technology solutions there to bring that to life. We will be launching a survivor network internally on Google Communities, which is another platform that we use. Again, the power of our colleagues and knowing again that there's a network of people who have experienced something similar that they can go to for that emotional support if they need to do that. I would love to be able to set our wider stores up of safe spaces. It comes with a lot of complexity, particularly around safeguarding training and awareness, but we have an ambition to be able to do this at the right time. I'm not sure if 2021 will be the right time, but it's something that we continue to work towards and to aspire to. And we're also looking to establish an employer conference later on this year as well, to contribute towards the 16 days of action against domestic abuse, to continue to raise awareness and highlight what we've done as an organisation, but how other people can get involved in this as well. So I will leave that there for now and come out and stop my share and hopefully get back onto screen and hand back over to you, Sarah.
Lovely, thanks Lisa. Like I said, I think COVID has definitely accelerated lots of opportunities, and there are lots of opportunities that exist, I think, within every single business and often at very little cost to the business as well. So if you are interested and Lisa's presentation there has inspired you to take some action and you want to do something similar, then please do get in touch. I'm going to hand over to Charlie Ryan now, who's our final speaker. He's the senior legal advisor for the Royal Mail Group, and he led the incredible project team, which Hestia are very proud to be a part of, and he created, we created online safe spaces. So I'm going to hand over to Charlie now, who's going to talk all about online safe spaces.
Hi, thanks a lot, Sarah, and thanks everyone for listening to me today. I think, Sarah, you were going to ask someone to do the slides for me because my tablet is not clever enough to do it.
I think Lily's going to be able to share the slides now.
Great, thank you. So I'm conscious we're slightly run out of time, so I will go through this at a bit of a pace. Online Safe Spaces is a domestic abuse initiative created and championed by both Royal Mail and Hestia. Next slide, please. Just very quickly, so I'll take us through what it is, how it started. The launch we had back in September. 7 months later, which is 7 months after launch, i.e. today, and then I put any questions, but I presume that'll be wrapped up with everyone else's questions. Next slide, please. So what is it? It's a discrete, safe, no internet history pop-up window that can be installed onto any website, internal or external. It provides expert advice and support to those who either are at risk or might be at risk of domestic abuse, and we'll get on to who the experts are in a moment. And just to emphasize, it is as safe as we could possibly make it, which is to say that if you were to go to any of the 21 websites on today, say royalmail.com, if you were to click on it and then interact with it, then there will be absolutely no internet history on your browser. So all it will say is royalmail.com, and there's obvious reasons as to why we've structured it that way. It's also that it has escape functions. So if you tap escape or tap anywhere outside of the pop-up window, it will just disappear. And you know, very obviously that's to protect users should their perpetrators peer over their shoulder. So if you go to any of the websites where it's on, what you'll see is a banner generally at the bottom of the website. So royalmail.com, Passports at the bottom. And the banner looks like the banner right at the top, which is you know, the online safe spaces. And of course, this was done in conjunction with Hestia and their safe space initiative, which Morrisons and Boots, of course, have done such great work with. So it's a perfect sort of alignment of what we're trying to achieve. So if you click on that, then this pop-up window comes up, and very quickly rattling through the functions of it. At the top, you'll see a select language function, and that the experts were keen to put in because within certain minority groups, there is a hesitancy to interact certainly with government services, and to a less extent services which might be interpreted as part of the government in some sense. So in order for this service to be attractive, shall we say, so I'm using really anodyne corporate language, attractive, shall we say, for potential users, it was great to have that language functionality. You'll see the 3 bullet points there: this safe space, leave no internet history, etc., etc. You then have the core functions. So the first tile, as they're called, tells you to call the police if you're in immediate assistance, and dialing or tapping 55 to the operator will be a silent code that you're actually in a domestic violence situation, and the police will then be directed to your address. Now, to those unfamiliar with domestic abuse, such as I certainly was this time last year, you might think, well, how's that helpful? Surely everyone knows that 999 is something you should call. Well, actually, as the experts will tell you, there are often instances where people are in a violent situation, domestic violence situation, and they phone a shelter. Who obviously can't provide police help, and that just makes an awful situation even worse. So that is actually useful information. The next 2 tiles, am at risk and local support services, those hack into, for want of a better word, the functionality of Hestia's Bright Sky app. So for those not familiar with the Bright Sky app, it has 2 great functions. It has a am I at risk questionnaire, which are 12 questions assessing whether you're at risk of domestic abuse and directing you to get help should you answer questions in a certain way. And the next tile on the first row on the right hand side, local support services, is the other function that we've sort of borrowed from Hestia. And if you type in your postcode to that box, another pop-up window will pop up at you, then having typed in your postcode, it'll give you local support services within the 5 to 10 mile radius, which is absolutely critical, because when people do reach out, we want them to get the best help they can get. What we don't want is a situation where someone's Googling their own address and adding something like domestic abuse or violence, etc., and then Google will quite often give them a steer which isn't particularly helpful, and then they might not follow it through and wait for the next domestic abuse or violence situation to arise a week, a month later. So you've lost that golden opportunity to help at the right time. So yeah, going at a pace because I'm conscious of the time. The next tiles at the bottom, contact national helplines. That's obviously, you know, says what it is. Equally useful links. And then there's a sort of blank tile, which for those organisations who want to install this on their intranet, such as Royal Mail, you can add a tile which links into your own domestic abuse initiatives. So, for example, for the sake of argument, Morrisons obviously have done tremendous work on domestic abuse internally, and perhaps for the sake of argument, so I'm doing a cheap sell on Morrisons here, but for the sake of argument, they could add a tile which would link into all of their tremendous material on domestic abuse. And certainly, more than just Royal Mail have used that 6 tile functionality. Next slide, please. So this is the 12-person team who well, we collectively put together. And just very quickly, just to give you some ideas to the level of expertise involved. So Hestia, and everyone knows Hestia, obviously. We also got academics from the University of Bristol, academics in domestic abuse and gender violence. And we also had on our team an ex-detective inspector from the domestic abuse team at Brighton Police, who actually she's moved on, was an employee of Royal Mail as of this time last year. So it's absolutely top tier expertise. And they got together with our IT team and created the software which we just looked at. Meanwhile, in the background was other functions of Royal Mail who just helped push the project along and get it executed and launched. So I won't go through it. You can, I'm sure, all read those teams. Next slide, please. So we launched last September. We got good national press attention. The BBC, a couple of nationals. Our head of public affairs was interviewed in Sky News, so it was really great. In conjunction with that launch, we had a sort of staggered launch of 6 lead partners. So eBay, MOD, and the Post Office announced 2 weeks after we did that they were going to install online safe spaces. And then about 2 months later, 3 global law firms announced that they were going to install online safe spaces as well. And from 2nd September onwards, we really went out to the world and approached our customers and beyond, asking them to install. And we'll get to that in a second. Just to mention also, at launch, we had endorsements from the people at the entities, I should say, at the bottom. UN Women UK, the UK Domestic Abuse Commissioner, 2 UK government ministers, and Sussex Police. So there was really strong endorsements, which we were very happy to receive. Next slide, please. So 7 months later, here we are. We've got 21 live participants. You can see their logos there. So law firms at the top, postal industry just below, then various, so MOD, Water Industry, Thames Water, Anglo Water will come online, I think, next week. The rail industry are super supportive. Then you've got some 4th sector entities, and then finally a pub called the Queen's Head in West London, which we're really pleased to have on board. And just to mention, a core objective of online safe spaces, as well as obviously just helping people in the first instance, but as part of that was to create a bit of software that we could give literally to anyone who wants it for free. We're offering it for free, and we were very careful to design it and create a process which made it as easy as possible for any organisation who wants to put it on either their internal or their external websites. And we are continually speaking to people. We're getting about 5 entities a week emailing us, and so we're very hopeful and optimistic as to the future, which leads on to the the next slide, please. So looking at where we are now, by the end of March, we estimate that we'll have around around 250,000 users, which is quite a big number, and we're both pleased that we're able to help people, and equally very cognizant that it's appalling that so many people need that help, but at least it's there. We're seeing a really quite consistent 40,000 users per month, which translates to around 1,300 a day. Just to quickly explain that figure, and it is important that I explain how we got to those figures. We only see clicks, we don't see users. In order to see users, we'd have to record IP addresses, which means that theoretically it's not anonymous. So that's why we only record clicks, and we estimate, and it's a crude estimate because it has to be a crude estimate, that each user clicks about 4 times. Now, clearly it'd be a miracle if we got that right, but that's our estimate. So if you want true figures, then just times each of those numbers by 4. So by the end of March, we definitely will have seen around 1 million clicks, etc., etc. Going forward, future confirmed participants, you can see a law firm, you can see a major UK telecoms provider, which everyone certainly would have heard of. eBay are in the process of putting on their website. We should have a high street bank may also install. So we're really optimistic, and we're pushing it to anyone who wants it. And part of the objective of this whole project, which has been referred to by earlier presenters, is by having a domestic abuse message and service on everyday websites. What we hope to do is to break the taboo that surrounds domestic abuse, and to make it a conversation, and to lessen the embarrassment that we all know people have who suffer from domestic abuse. And yeah, we're really excited by this project, and we're really grateful both to Hestia and all the many partners we've had on this. Okay, I think that's just on the nose 10 minutes. So thank you very much.
Thanks so much, Charlie. So unfortunately, we've run out of time. I'm just aware that it's 3:25, and we're closing at past. So we've run out of time for the Q&A today, but we've had a lot of people that have submitted like questions throughout the event. So what we're going to do is email everyone after the event the answers to those questions, and then send all the information around physical and online safe spaces. Before I quickly pass on to Lindsay to have final word and close the event, it's just a quick reminder. Lindsay mentioned earlier that this week is No More Week, and tomorrow we're asking everyone to download a graphic from our webpage, which I believe has been shared in the chat, the link to that. So just download that graphic, and please do share on your social media platforms. Our aim is to reach as many victims as possible and let them know that they're not alone, and that these safe spaces that we've heard about today are open and ready for them to use. And just another quick note is that if you have been inspired to take some action today, there's also many different forms of fundraising ideas for your workplace to get involved in, including challenge events once the lockdown eases. So please do get in touch if you want to find out more by emailing the fundraising team. I'll hand over to Lindsay now for the final few minutes.
Thank you so much, Sarah. That's so lovely. And I guess that's really just one thing left to say, is that, you know, when we started thinking about how we could use UK Says No More as a campaign to reach the friends, the family members, and the colleagues, to enable them to feel empowered to be able to respond to people closest to them if they're experiencing disclosures, we started with a very strong communications message, but actually soon realized that to achieve that, it's by working together. And we are so overwhelmed with the support from everybody that's spoken today, but also everybody that has joined, whom are all looking and what resources they have available, but also their overwhelming commitment to responding to victims of domestic abuse, and those victims receiving the support that they need in the most reduced journey as possible. So when we always pull to a statistic where many people will say that they often spoke to between 12 to 15 people before they access the support that they really needed around domestic abuse. And what we want to do is see that reduced down to, I spoke to the first person and they were able to link me with that specialist support service. And so, yeah, we're incredibly grateful for all of our speakers today who've shared their experience and their journey, and obviously the overwhelming support, and you know, the support that is really there for those that are enduring domestic abuse and their children. You know, we know the statistics around 1 in 4 women and 1 in 6 men who may experience domestic abuse, and as an organization we estimate that just under 1 million children are living in homes where domestic abuse is happening. We know we've got the domestic abuse bill in its final stages, and we hope to see it concluded before Easter. But even still, we know that there's a long journey ahead of us, of all of us working together to say no more to domestic abuse before we get to that place where what we all really want is it to not happen. So thank you again for everyone who attended, and a massive thank you for everyone who spoke, and an extended thank you to all of the teams that work at Boots, Morrisons, Superdrug, Wells Pharmacy, and all the independent pharmacies across the country whom are stepping up and experiencing those disclosures and looking at their response. And also a massive thank you to the Royal Mail and all of the partners are on online safe spaces, because without them we wouldn't be able to get this message out there in a different way. And a massive, enormous thank you to Claire and all of the independent and individual pharmacy bodies for giving us and donating time and energy and insights and commitment to this program, and we look forward to seeing it expand. And as I mentioned earlier, we're really chuffed to say that, you know, TSB is expanding their pilot into further 2 branches later on, and we can see how this project will continue to grow. But in reality, it will always grow together, because only together we can end domestic abuse and sexual violence. So let's all join to say no more for the final comment, and thank you. So I guess what we'll do now is we'll close the event. We will have the recording available in the next couple of days so that you can continue to share it amongst your networks. And like we've mentioned, if you want to reach out and chat with us about how to join or how to link a safe space to your organization, you can contact us via UK Says No More website or the email address. If you're interested in the online safe spaces, there's a community at Royal Mail email address, and we'll work with you to put that in place. But any other questions, please do either contact us on social media or via the email, and we will be in contact. So thank you very, very much.